right, everyone. Thank you so much for joining us today. I think we've reached a critical mass here, so I want to first thank you for signing up for this webinar. I'll briefly introduce myself. I'm Isabella Lee. I am the project manager for the Caring Force at the Providers Council. I manage this and a lot of other public policy and somewhat communications related things as well. And I'll let Caroline introduce herself too.
Hi, everyone. Happy to be with you all. I'm Carolyn O'Neill, and I'm the Manager of Public Policy and Communications here to support Isabella today.
All right, so with that, I'm going to share my screen. We'll get started. There's a Q&A box available for you to submit your questions, but we'll be taking questions mostly at the end. There'll be a lot of time for it, so don't worry. That's definitely the bulk of what we want to get to. All right, so rallying with the Caring Force, how to rally and how to advocate. It's just a brief overview of who we are. The Caring Force is the grassroots advocacy initiative of the Providers Council. We empower supporters of the human services sector, like you, to drive meaningful change. Our mission is to create a stronger Massachusetts that protects the most vulnerable neighbors while ensuring that human service workers receive the pay, recognition, and respect that you deserve. So this is going to be our agenda today. We'll briefly discuss our budget priorities, then go into our legislative agenda for 2025, then explain some advocacy opportunities that are available to you, and then we'll go into the questions and answers that you may have about any of these topics. So first up is our priorities. The number one thing that we always want to maintain is the Chapter 257 reserve, which is line items 1599 to 6903 in the budget, at $207 million in the present budget for 2026. This is the budget that Governor Healy has proposed. It still has to be approved by the legislature, but once it is, we're hoping that it maintains this $207 million funding. The rates of reimbursement for Chapter 257 go directly to supporting human service workers and your wages. I don't know if Caroline, you want to add anything else about Chapter 257?
Yeah, this is essentially the rate setting measure that EUHHS uses, and it impacts all of the rates underneath that Health and Human Services kind of capture. And it's reviewed every other year. So we are constantly advocating for a larger number in this budget item. And in mid-April, we expect to see the House budget, and that's when we'll know kind of the movement in this line item.
Awesome, thank you. So the other two things that we're working on for our priorities are passing an act relative to a livable wage for human service workers, which is currently Senate Docket 1201 and House Docket 3396. They were introduced in January, but we're still waiting for it to go before the committee and get a bill number. And then the same thing for pass an act relative to a loan repayment program for human service workers, which is Senate Docket 1820 and House Docket 503. Once these go before the committee, they'll get the bill number and get the process started. But we'll go over that a little bit more later on what the process of a bill is. So the first bill that we discussed is the livable wage bill. What's the problem? The problem is that low wages of the sector cause recruitment and retention issues, and that ultimately leads to wait lines for services, program closures, forced overtime, and generally a lower quality of life for the human services sector. The solution would be to pass this bill. It would eliminate the pay disparity that currently exists between the salaries of human service workers that are employed at community-based organizations versus the ones that are employed by the state, all who do similar work. Some of the key facts for this is that there are many similar job titles and roles for the workers in the Commonwealth that work in the private community-based human services and the ones in the state. However, the ones at the state level are paid significantly more for essentially doing the same work. Plus, the Commonwealth is the largest purchaser of human services from community-based nonprofits, which essentially means that a lot of things that go from the state go directly to the nonprofit organizations, making them work as a team, which even pushes for more reason that they should be paid the same amount. Model budgets created by the Commonwealth often have a lower salary than what the state pays for similar roles. The salary gap makes it very difficult for the community-based organizations to retain and recruit qualified workers. The human services sector has nearly 160,000 jobs, and many of them are currently not filled due to this specific pay disparity. And that's ultimately going to cause a workforce crisis, not only for the human services sector, but it'll lead to problems that we'll be caring for our most vulnerable neighbors because there's not enough workers to take care of them. Those people are going to suffer the most. Another important component of the livable wage bill is that last year when we tried to get this passed, we did get language that included the creation of a report that should be released on April 1st, 2025. It's going to be coming out of the Executive Office for Health and Human Services, and it's essentially going to explain how much it's going to cost to get those wages at the community-based organization level up to the state level, and the timeline for how they can increase that. If this legislation is passed, it would set that schedule to get the community-based human service nonprofits up to the same standard as state workers. It would have that schedule be that these have to be at equity no later than July 1st, 2029. And it also applies to the private community-based human service nonprofits that have contracts with the Executive Office of Health and Human Services, the Executive Office of Elder Affairs, and the Executive Office of Housing and Livable Communities. So if you have any questions on that, make sure to jot them down now. We'll come back to it later. But now we're going to discuss our second bill, which is the loan repayment bill. The problem with this is that the lack of affordable higher education for human service workers and the burden of student debt also greatly contributes to the sector's recruitment and retention difficulties. So currently this is Senate Docket 1820 and House Docket 503, and it would help organizations recruit and retain the human service workers by having the state repay qualified education loans. Applicants would be eligible to up to $6,000 if they have an associate's degree, $20,000 if they have a bachelor's, and up to $30,000 if they have a master's degree. An important point here is that last year what we had passed was an ARPA-funded student loan repayment program, and it received requests for more than 3 times its $16.5 million allocation. This ARPA funding was a one-time student loan repayment, and so the bill that we've introduced this year would make that sustainable funding to continually be able to help the human services sector with their loans. Some key facts on this is that direct care 1 workers earn $20.79 an hour, but the MIT living wage calculator suggests a wage of nearly $28 an hour for a single person with no children in Massachusetts. In the first half of 2024, the average student loan balance in Massachusetts increased by over $2,000, reaching almost $40,000 for an average of individuals across the Commonwealth. The residents also had a median monthly student loan repayment of $226 in 2024, which is the second highest in the nation. About 70% of human service workers have attended some college or have a degree, meaning that they're almost all qualified for this program. If passed, this legislation would first amend Section 16 of Chapter 6A to create a student loan repayment program for human service workers who have worked at least 12 consecutive months and 35 hours per week who hold these degrees and certificates. The priority will be given to applicants with 3+ years of experience, those working in advancing health equity in Massachusetts, and in individuals earning under $60,000 annually, and those who provide care in a non-English language. The program aims to help organizations recruit and retain human service workers by repaying their loans. They must also commit to be working in an eligible setting for 1 year with an associate's degree, 2 years with a bachelor's degree, or 3 years with a master's degree after receiving this funding. The payments would be made directly to the lender during months the applicant works 35+ hours a week as a worker here in Massachusetts. The program covers all qualified educational loans, including interest incurred while obtaining the certificate or degree, and it would be managed by the Executive Office of Health and Human Services. So very briefly, this is how a bill becomes a law. The bill has been filed, so that part has already happened. We're currently on stage 2 of getting co-sponsors to sign on. If you're already receiving information from the Caring Force, you've probably seen a couple emails from me encouraging you to email and contact your legislators to sign on to be co-sponsors with our bills. Next up, it'll get joint committee and hearing, and you can read through just for a second on what happens next. It goes through a lot of committees, a lot of floor debates, and ultimately, hopefully, the governor will sign it to become law. This is our current budget advocacy timeline. I'll give you a second just to look at that. So for example, Governor Healy, she introduced her budget in January. And so now it's going to the House and then it'll go to the Senate. So hopefully by late summer, that'll be approved and we'll know how much funding will go to Chapter 257 by then. So now the important part, why are we rallying? The biggest thing is that we have strength in numbers. We need as many people as possible related to the human services sector or already working in it to show up and remind legislators that this is important. You are the expert in this story. Nobody knows it better than you. You're the one who's been working every day and knows the details of what goes into it and why you need more support. Especially because you need to teach the legislators what you know. A lot of them don't know the details of what goes on behind the scenes. They have a very high level understanding of the situation. And so the more that they can connect with you and the more that they can hear why this is important, the more that'll stick with them. And finally, it's great to build this community as well, to know that we can always support each other and push together for the more respect and recognition for human service workers. So these are our upcoming advocacy events this year. There's a long list. We're very happy to have expanded this list from last year. We're essentially co-sponsoring several legislative breakfasts, and then we also have a handful of regional rallies. All of the RSVP information is available on our website, but there will be a QR link a little bit later that will lead you to that. So take a note now, perhaps you see something that's in your region, and most importantly, our State House rally is going to be on May 8th. So make sure to mark your calendars for that. Here's some photos from our regional rallies last year. We had a great success with them because people who attended were able to meet with their legislators in their own backyard. It wasn't as big of an ask to go all the way to Boston and rather, something close by, a little bit more intimate. We had about 200 plus people still at every rally, so there was still a lot of support and we're excited to have this keep going this year. So what are some tips for a successful rally? If a legislator and staff aren't available, make sure you leave behind resources and a note. You take photos with them while you're there and tag them on social media and also send follow-ups with thank yous or cards. The biggest thing about pushing for these bills is that it's great to go to the rally and it's really, really important, but we have to keep pushing them afterwards too, just to get through all the noise. The legislators have a lot going on, so the more that we can unify and continue to share your story and remind them who they are and, oh, we met this day, remember these bills are on the floor today, things like that, it'll be really helpful in getting these bills across the finish line. Another thing that you can do is tag them on social media. So this is an example, Communities for People. This is a post that they did after our State House rally in 2023. You can share your story there. You can make sure to tag your legislators here too, and also to tag us so that we can help amplify your voice and your message, and also to use the hashtag Caring for Us Rally. So this is something to keep in mind ahead of the advocacy events that we have this year. Another way that you can be involved, if you'd like to have even more involvement in the caring force, is to be a captain or an ambassador. So as a captain, you are more behind the scenes. You keep your colleagues informed of what's going on, support rally efforts by coordinating people to attend, coordinating t-shirt orders, the yellow t-shirts that you saw in the photos for everyone to wear so that we can all have a unified look, and to most importantly spread the word to your friends, family, and colleagues, and anybody else that's interested in supporting the human services sector. The biggest thing about a captain is that there's no public speaking required. As an ambassador, however, your voice matters. We might ask you to testify at the State House and help share your story once it's time for the bills to go to debate. You can connect with your legislators by writing letters or making calls, and especially attending meetings to make your voice heard. You can speak at one of our events. Typically at our rallies, we have a handful of people who work directly in the sector sharing their stories about why it's really important to support the sector and to just explain a little bit more about their daily life to the people who are in attendance, especially the legislators. And you can also additionally spread the word, just like captains, to your friends, family, anybody who's interested to attend the rallies. So I'll give you a second now to scan this QR code. This should lead to all of our social media signups for the rally on May 8th, signing up to be a captain and ambassador, and even more resources. So I really encourage you to check it out. This is also continuously updated. So at any point, if you want to, see if there's some new resources available from the Caring Forest, you should be able to go back to the same link and see what's available. So I'll give you just another couple seconds to scan that. And if anyone's having issues, please let me know in the chat, and I can also send you a link. I'll put that there later too. All right, so finally, the moment you've all been waiting for, time for questions. So Caroline and I will be monitoring the question and answers chat, and we'll go from there. Thank you so much.